Hello, I am Dr. P Goel. I am an honorary senior consultant, neurosurgeon, and today I want to talk to you regarding what precautions we should take once you are diagnosed as an epileptic patient or you have epilepsy. First of all, you have to understand that epilepsy is not a contagious disease. So if you have epilepsy, other people in the family cannot have epilepsy just because they are near you. Second thing is, it is very important for you to follow the doctor's advice, and one of the main advice to follow is that you have to take your medications regularly, which are prescribed by the doctor. And once you have taken your medicines regularly, then it is very important to get a regular review from the doctors at different intervals. One thing you have to understand that many people feel that medicine has to be taken exactly at the same time. No, that is not true. You can take the medicine morning, evening, or whatever prescribed by the doctor, but it is not very important if you are taking, at 9 o'clock or 10 o'clock or 11 o'clock, because you can vary according to your lifestyle. Second thing very important is that there are some trigger factors where the epileptic attack can occur even if you are taking medicines regularly. One of the most important trigger factor is lack of sleep. So you should sleep for at least 6 to 8 hours daily. Second trigger factor is lack of food. So you should eat regular meals, which are at least about 4 meals, breakfast, lunch, afternoon tea, and dinner. Third trigger factor is the tiredness. So whenever you are very tired, you should take rest in between, or in a long journey or long drive, you should take rest in between. And if you are watching television, then you should stop watching for a few minutes after a certain interval. And third trigger factor is, and the next trigger factor is the fever. If you have a fever, then immediately go to the doctor and have some treatment for the fever. Now let me talk about the schooling and other things. You have to understand that you can lead a normal life, and the school should not prevent a child who has got epilepsy in any way. And that is against the law also. So the child should lead a normal life in school and at home, and there is no effect on his intelligence by having epilepsy or by taking medication. The intelligence level is not affected at all by the epilepsy or by the medications. Third thing is, as you yourself should lead a normal life if you have epilepsy or taking a regular medication. If you have got no seizures at all, then you can do a normal driving. But if you have, unfortunately, if you have seizure at some time, then you should consult your doctor that how long you should stop the driving. And sometimes if you are changing the medication or if the doctor is reducing your medication, you should be careful of being alone in a swimming pool, or you should be careful about heights. Now next comes pregnancy. If a patient who becomes pregnant is taking anti-epileptic medication, that patient should consult the doctors, because sometimes the medicine needs changing if a patient has got pregnancy. But there are a lot of medicines which are absolutely safe in pregnancy and for the child. So these are the important things which you should consider, and I wish you all the best and the luck. And remember that epilepsy is not a disease. It is just something which is a part of the life, and lead a normal life. Thank you.